Hello everyone, we have with us today Dr. Dharav Kheradia, who is an intervention radiologist and who is going to tell us about the most recent and most advanced treatment for uterine fibroid called as uterine artery embolization. Hello doctor.
Hello.
So what are uterine fibroids, doctor?
So uterine fibroids are basically it's a tumor. Now we have two kind of tumor in the body. One is benign, which is non-cancerous, and other is a cancerous. So uterine fibroids are the non-cancerous tumor of the uterus. So they are very common. They affect almost 80% of women by the age of 50 years. Many of them may not produce any problem, may not produce any symptoms, but many of them are producing symptoms. So what are the common symptoms? Excessive bleeding during menstrual period, prolonged bleeding which will last more than 1 week time. If the fibroids are very big, they can produce pressure symptoms in the pelvis, like it can compress the rectum and cause constipation. It can cause compression on the urinary bladder, it can cause frequent urination, difficulty in passing urine. Sometimes they can cause pain, discomfort, they can cause backache, and in some cases they can cause infertility also, that is difficult to conceive a child or become pregnant. So these are the common symptom of uterine fibroid.
Now doctor, how to diagnose uterine fibroids?
So if you are experiencing these symptoms, generally first doctor you contact is a gynecologist, and then when you visit a gynecologist, he or she will do some local examination, and the next stage is to do sonography test or ultrasound, which can easily diagnose uterine fibroid. In some cases we may have to do MRI also if there is doubt.
What are the treatment options available for uterine fibroid?
So various treatment options are available to treat uterine fibroids, like the medicine, surgery like myomectomy, hysterectomy. But nowadays we have non-surgical treatment option called uterine artery embolization. So today we are going to talk about that option in detail.
Now doctor, can you just brief us about the recent technique that is uterine artery embolization to us?
So let me explain to you what is embolization. Embolization is to block the blood supply of the particular organ. So when you block the blood supply of the uterus, you call it as a uterine artery embolization. Any tumor depends on blood supply to survive. So once you block the blood supply of the tumor or the fibroid in this case, it will shrink over a period of time. So that is the basic concept of the uterine fibroid embolization. So how do you block the blood supply? So using a very small tube, very small nick in the wrist artery, we enter into the uterine artery. We do angiography, we identify fibroid blood supply, and using very small tube and using very small particles, this blood supply is blocked on both the side, right and the left side. So once the blood supply of the fibroid cut off, over a period of few weeks it will shrink in size. So this technique is done under local anesthesia without any incision or suture, anything. It's just very minute pinhole in the wrist. This procedure is done under X-ray guidance, and it will hardly take 45 minutes time. So that's the uterine artery embolization procedure.
Now doctor, can you tell us the post-procedure recovery process, in the sense when the patient can resume his normal day-to-day activities and resume work per se, which is most important for the patient?
Okay, so after procedure, patient may experience pain lasting for 24 to 48 hours, cramp-like pain, maybe in some cases spotting may be there, and generally we keep patient 1 day after procedures, and most of the patient can resume work within 7 to 10 days after the procedure. So recovery is much more faster.
Now doctor, why should one prefer uterine fibroid embolization and not the surgery?
I'll tell you why. Because it offers several advantages over the surgery. Like it's a minimally invasive procedure, so less risk are involved as compared to the surgery. No need of any blood transfusion, no need of any suture, stitches. So less hospitalization time is required. It is less painful as compared to the surgery, and it is cost effective. Cost is either less or same as the surgery. It will treat all fibroid at once, and most importantly, you will preserve the uterus and thus the womanhood. Your periods will be like a normal period before, and it is recommended by American College of Gynecologists, Royal College of Gynecologists as a standalone treatment for the uterine fibroid. Uterine fibroid embolization or uterine artery embolization is very safe and very effective method to treat uterine fibroid. It has more than 90% success rate. So if you are experiencing symptoms related to uterine fibroid, we encourage you to visit nearest interventional radiologist to see whether uterine artery embolization is suitable for you or not. Thank you.